And now we go on to Dr. Mallika's tips for safe and effective PVD induction.
I'd like to thank Dr. Ajay Arora for this opportunity and this good session. Very unusual and good. Uh, how do we, can we, it's already there in that only.
Change it to the mirror.
Standard, dynamic. Can you do something? I don't know what's that mirror thing. Appearance, title, body. Morning it was okay, I checked. I guess we can carry on with that way also, but it won't look good. Okay, no problem. So the layout is like this. Audio visual, there is no support at all, so fine. Um, Tips for safe posterior vitreous detachment induction. See, in macular surgery, the step that is likely to cause retinal tears and retinal detachment is only PVD induction, because we apply very high suction on the posterior vitreous, which gets transmitted to the peripheral vitreous, leading to flap retinal tears. So I realized that one of the ways could be to break the continuity between the posterior vitreous and the peripheral vitreous before we start applying high suction. And so it's important to make a careful attempt to do a good mid-peripheral vitrectomy, separating the posterior vitreous from the peripheral vitreous. So this is how, after a core vitrectomy and before applying a suction like this, as we apply suction, we start seeing that there is still some attachment to the peripheral vitreous. So again go back, again do mid-peripheral vitrectomy, again remove. The idea is only to separate the posterior vitreous, isolate it before applying high suction. And again we can apply high suction. Otherwise we create a lot of retinal tears which we don't even see during surgery and cause a detachment later. Now triamcinolone acetonide definitely stains vitreous the best for PVD induction. However, in a phakic eye, it does accelerate cataract. In a patient who is immunocompromised like AIDS, we operate for CMV retinitis. It can aggravate CMV retinitis or cause other infections. And it increases the risk of endophthalmitis overall. So what is the solution? We can use dyes which we use for ILM to stain the vitreous as well, and they work in most of the cases. If required, we can add diluted little bit of triamcinolone on top of the dye to improve the visibility of the vitreous, like this. So now most of the PVD induction or vitrectomy is done with dye as a stain for the vitreous. Again, mid-peripheral vitrectomy. And this was a patient where the foveal roof is very thin. There is a high risk of deroofing. So here we don't apply high section. It's manipulation by very low suction, cutting intermittently, cutting and low suction, so that we do not deroof the case. And you can see that the dye stains the vitreous reasonably well, though not in all cases. And this was a phakic patient, so that's why I preferred dye only. Very little orocot. And now this roof has been intact because of the care we have taken. So similarly, another patient where we are using cutting over the macula, because this is again a patient with impending macular hole, so risk of deroofing. Just cutting over the posterior vitreous, not aspirating. And then, as the previous talk, sometimes whatever suction you apply, you cannot lift up the vitreous, then just use a pick and a forceps to induce PVD. This is vitreous actually, this is not a membrane. Thank you.
Excellent, Mallika. Any questions? So have you ever used fluorescein for many early days? I have tried using fluorescein when I was hesitant to use tricot, and it works beautifully well. It
Yeah,
stains
but
the entire vitreous, and the PVD gets induced
yeah, I
extremely
think
well.
anything would work. Only thing is then the laser becomes little more risky because that absorbs so much laser. Possibly you can't even do laser, or if you do, you might end up with very strong burns, possibly.
Okay.
That's why last video was where you take a needle, bent tip needle or a pick, create an entry somewhere near the disc, and then pick up an ILM forceps and peel it off. And I showed how it comes off also. You're right, there are cases where aspiration just doesn't work.
There's a special spatula which is made for induction of PVD, which many of us don't use it anymore, but it was available many years